I'm 36 weeks pregnant with cramping and back pain. What is going on here, and what should I do?
Everyone gets back pains at this point in the pregnancy.
These seem worse than before.
Have you had a urinary tract infection?
I think every pregnant woman gets them.
If you've been dealing with a urinary tract infection, it could have turned into a bladder infection. Then you have pressure in the pelvic area, cramping of an inflamed bladder, and even back pain.
I'd expect a fever if that were the case.
Probably. And if you had a fever with stomach cramps and vomiting, the back pain could be due to dehydration or strains as you tried to rush over to the toilet.
I haven't had vomiting like that.
Some women develop really bad constipation.
That wouldn't explain the back pain.
If you added too much fiber to your diet to compensate, you could get severe stomach cramps before the bowel movements.
That wouldn't last this long.
If you are taking those iron-coated prenatal vitamins, and then you took more than the recommended dose to try to offset the fatigue you feel in the third trimester, your body could be cramping over it.
Again, that'd only be in the digestive tract or result in super pooping until it passed.
Have you passed the time watching a clock while dealing with the cramps?
No, but it seems to take forever.
If you have back pains and stomach cramps that ramp up and ease, then come back 10 minutes later every 10 minutes, you may be in labor. If it comes back in 10 minutes before returning in 9, you need to get to the hospital.
You think this is a sign of early labor?
You are 9 months along.
I'd be 4 weeks early.
There are women who have premature babies at week 30 and it lives, and you're 6 weeks past that.
And I'd be worried about that.
If you are only having cramps but your water hasn't broken, go to the hospital. They can give you a shot to stop labor in most cases as long as there isn't an underlying condition to prompt it.
I'm pregnant, that's what prompts labor.
In some cases, the woman goes into early labor due to an infection or dehydration. Or she has to be induced due to high blood pressure.
The inducing of labor because you have preeclampsia requires the high blood pressure signaled by seeing red, headaches, high blood pressure readings, swelling of the legs beyond what's normal. I don't have that.
Then you may have standard early labor, which a doctor can treat one way or the other after you get to the hospital.
What else could cause these back pains that isn't labor?
You were carrying a heavy load with your back instead of your legs, straining what is already carrying a heavy load in front.
No, I haven't done that.
Or you tried yoga that twists the back and strains already strained tendons.
I have trouble just reaching down to put on my shoes.
Then we're back to ask a doctor just in case.